Welcome, dear friends. Today, we have another interesting session coming up. For that, we have the National Chairperson of 2024 for the Allergy chapter, Dr. Krishna Mohan, who will be interviewing Dr. Vikram Patra, who is a prolific practitioner from Mumbai, Navi Mumbai. So, both of them will be talking about the molecular diagnosis and the advanced diagnostic tools what are available for today in 2025.
CRD or component resolved diagnosis is the one of the recent advances in allergy diagnostics. So, Dr. Vikram, what exactly is this CRD?
A very good question, actually. This is a hot topic in the field of allergy. Now, when it comes to the diagnosis of allergy, conventional test what we were performing, allergy skin prick test, and the serum specific IgE to detect to what things a patient is allergic to. But there are certain advantages or disadvantages of the conventional test. So CRD, rightly mentioned, component result diagnosis is a new tool or an advanced tool in the field of allergy, where not only the allergen but the components of each allergen is being evaluated. So basically, if I go into the basics, our body produces IgE antibodies against the allergens. Now, these IgE antibodies or these allergens, they are not a single structure, they have various epitopes. So, when we say Ig against a particular allergen, so each allergen is made up of different epitopes, or it has got different amino acid sequences which are called as epitopes. So, when we say Ig against an allergen, for example, if I say house dust mites, these house dust mites, they have different epitopes in the form of DERP1, DERP2, DERP10, DERP23, and many more. So our IgE, we have separate IgE for each component. So each component, they sum up to give the serum specific IgE against house dust mites. So component resolved diagnosis, they pick up these component IgE for diagnosis.
Okay, you talked about allergenic components, but in our day to day practice, what does this knowledge about allergenic components, how will it help us? So, compared with our conventional skin prick test or our specific IgE test like immunocap, how is this going to benefit us better?
So, still, if you ask me what is the gold standard for diagnosing allergen, it is skin prick test. But certain advantages of component resolved diagnosis to mention. So, basically, if you want to start allergen immunotherapy, certain markers are there. If marker allergens are positive, then it will guide us in selecting a candidate who is suitable for AIT or allergen immunotherapy. It also helps in assessing the severity also. It also assess and diagnose cross reactivity. So remember I mentioned about the different epitopes. So different allergens from same species or different allergens from different species, many times they share certain epitopes. So if a person is sensitized to one allergen, on skin prick test or the serum specific IgE, the other allergen which is sharing the same epitope may come positive. So when you do the conventional test, you will not be in a position to differentiate whether which one is the true allergen which is responsible for the patient's symptom. So here component resolved diagnosis is helpful.
Okay, so do you mean to say that CRDs are going to replace all the conventional systems of
No, not at all. Not at all. It is just going to complement the conventional, the gold standard test in the field of allergy.
So, what do you think about the cost? Is it cost effective, or nowadays there are a lot of irrational practices where these tests are prescribed unnecessarily? So, what is your opinion regarding what should be the ideal or rational way of prescribing CRD?
So, as an allergy practitioner, we always insist on taking history first. So, history suggests our further investigations. So, even when it comes to skin prick test or serum specific IgE, we ask for specific allergens to be tested depending on the history. We never ask for panels. Now, we fear if we don't have proper knowledge in the component resolved diagnosis, it will become one more panel in the basket. So we don't want that. For that, component resolved diagnosis or thorough knowledge should be there. We should be trained to interpret, and then definitely it will become a good instrument in diagnosing and managing allergic patients.
So, Dr. Vikram, you were telling regarding the use of CRD in allergen immunotherapy. So, how is it going to help in immunotherapy?
So after assessing clinical history, when in the past when we used to do skin prick test or serum specific IG, we used to start allergen immunotherapy, and then typically what we say and what is there in the literature, we must wait for at least 1 year and to decide whether the immunotherapy is working or no. So after 1 year, if the patient is not showing response, we used to stop. So but by then, for a 1 year immunotherapy, the cost was too much. That becomes a burden for the patient. Now beforehand only, by doing component resolved diagnosis, we can select the right candidate who will improve with immunotherapy or no. For example, if I come to a cross reactivity, and if I give an example of house dust mite, which is common in our country. So as I mentioned before, dust mite has got various components like DERP1, DERP2, DERP10, DERP23. So if I just give these four examples of components, out of these DERP1, DERP2, DERP23, these are the major allergens in the dust mite, and they are responsible for most of the symptoms. Whereas DERP10, it is tropomycin. So as you know, dust mite, those who are sensitized to dust mites, if you do skin prick test to cockroaches or shellfishes, then your skin prick test may come positive. And that is if DERP10 is positive, that cross reacts with the different epitopes in cockroach and shellfishes. So if I do beforehand, before starting AIT, if I go for components, so if DERP1, DERP2, DERP23 are absent and only DERP10 is present, I may not start immunotherapy for this patient. This is not an ideal candidate to start immunotherapy.
You also told about how this is going to prognosticate in food allergies, like if it is a case of milk allergy or egg allergy. So can you tell some example for that?
For example, if I say food allergy, many a times in our country we don't get proper history regarding the dietary history and what is exactly responsible for the allergy creation. So in such cases, yes, component resolved diagnosis helps a lot, not only in diagnosing but also assessing the severity. So if I give you an example of say peanut allergy, now there are various components in the peanut, RH1, RH2, H3, 6, 8 and 9. So if a person is allergic to RH8, they will show mild reaction. Whereas if RH2, this is considered to be the major allergen or the marker allergen, and it is responsible for severe reactions like anaphylaxis. So if a patient has got RH negative, H2 negative, that means I may ask them to eat peanut, a cooked peanut the patient can tolerate, because few allergens, they are allergen components, they are stable, which can withstand the heat, whereas few are labile. On cooking, they get denatured, their allergenic property goes off, so that a patient can tolerate.
Okay, so thank you so much, Dr. Vikram, for making the topic so abundantly clear. Thank you.
Thank you. So now that our
But on a clinical practice basis, how is this CRD going to... Anju, can I take the question again?